Welcome everyone to today's webinar. I am Aaliyah Pavela with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. At this time, I am pleased to turn the floor over to Colt Briner, Chief Marketing Officer with Ensemble Health Partners, to begin today's presentation.
Great, thank you so much. And I really appreciate you guys all taking time to attend this webinar. What we're really trying to do today is get very concrete about how to leverage analytics for improving the operation of a revenue cycle. We're going to talk about 5 ways to transform healthcare revenue cycles through analytics. And like I said, we're going to get very concrete about it. So operationalizing the insights that you gain and what insights to gain through analytics. So let's take a quick look at the agenda. So for today's webinar, we're going to start with understanding the 3 stages of applying analytics to the revenue cycle. We're also going to take a look at how to leverage artificial intelligence and automation to increase cash and reduce costs to collect. Then we're going to look at how to leverage analytics and workflow automation to reduce your denial. Then we're going to go to how to reduce costs to collect instantly with very little effort. That's going to be a big one. And then finally, we're going to get to how to get started with analytics in the revenue cycle. So, really making sure that when you leave this webinar, you're able to go back to your own revenue cycle and have a meaningful impact. So let me just quickly now introduce our presenters for today. So David Hitzel is Senior Vice President of Revenue Cycle at Ensemble Health Partners, and he has been instrumental in operationalizing analytics and automation into our own revenue cycle workflow. So he's very much had his hands on the operation here and knows how to execute the strategies we're going to be sharing with you today. And then Peter Schouten is our Chief Analytics Officer. He's led development of a number of innovative analytics and automation solutions and inventions, and he is listed as a key inventor on 7 of Ensemble's technology patents. So let me now hand it over to these folks to take it away.
Great, thank you, Colt. Everyone, this is David Hitzel. Appreciate everybody's time this afternoon. Before we get to the core of the discussion today, I want to provide you with some background on our company. Ensemble Health Partners was founded in 2015 by Judson Ivey. He's a revenue cycle operator who had a vision. Judson felt that the revenue cycle outsourcing needed a new approach. He believed in being operators versus consultants, working within client systems, not forcing technology in the revenue cycle management, sharing the playbook to improve operations, a better alignment of incentives, and then being data-driven in decision-making. This approach has caught on in the market, and we've grown rapidly, as you can see from the numbers on this slide. With that being said, at this point, I will hand over the presentation to Peter. He'll begin to talk through Ensemble's approach and reason for leveraging analytics to improve operations. Peter?
Thank you, David. Let me start by saying that leveraging data in healthcare today is a huge topic. There is just a ton of data that healthcare providers are collecting. So there's massive volumes of data, and the potential payoff is there without any doubt. But while some results are coming in, honestly, much of the promise is still out there, and it's still somewhat elusive. And we believe there's a number of reasons for that. And those reasons we're going to address throughout our presentation today. The first reason is that healthcare really is a very complex business that combines clinical decisions with business decisions and issues, especially in rev cycle. Also, healthcare professionals typically do not like a black box approach. So when we're trying to implement analytics, transparency is the key. And black box approaches or models are a difficult sell, particularly when you're dealing with experienced healthcare professionals. And finally, healthcare is typically led by management that has a lot of domain expertise and experience. So they rely on their knowledge and their expertise, and that's really key to their success in business. But they also rely heavily on some of their intuition. So that's something that we need to address as we're trying to implement and pursue analytics. Let's look at an example where intuition may actually not be the best guide. And this is an example, nothing to do with healthcare, but it's something that you might find interesting. Steve is a very shy person, and he's withdrawn, invariably helpful, but with little interest in people or in the world of reality. A meek and tidy soul, he has a need for order and structure and a passion for detail. And so the question is Steve more likely to be a librarian or a farmer? So before we answer the question, let's look at statistics and actually dig into some facts to help us guide us through the answer. It turns out there are actually 5 times more farmers than there are librarians in the United States. So there's a much higher chance that Steve, despite his personality, is a farmer. Additionally, 80% of librarians are actually female, which actually skews the answer even more heavily towards farmer. So the odds that Steve is actually a farmer is much higher, despite his personality. And so while intuitively it might be tempting to say, oh, well, Steve could be a librarian because I'm looking at his personality, the numbers would actually prove otherwise. So following intuition versus leveraging data can actually sometimes lead us in the wrong direction. However, intuition and judgment can also be the key to make a decision. So this is the dilemma in healthcare that we're dealing with oftentimes. How do we strike a balance between intuition and domain expertise and the power of data and analytics? It turns out that machines are actually much better than humans at the heavy lifting and at processing of lots of data without any bias. Machines can quickly process visual information, which we call iconic thinking, but machines can also readily identify associations of this item relates to that item. And that actually permeates revenue cycle, and we call that indexic thinking. However, humans are much better at symbolic thinking and putting things together, or completing the picture, or making a final judgment. So the key that we find to successful healthcare analytics actually combines the best of human expertise, which is symbolic thinking, with the best of the machine, which is indexic and iconic thinking. Let's look at the 3 stages of data analytics and revenue cycle as we like to define them. And there's actually probably 4. The first one we're not going to discuss today, and that's reporting. And there's lots of talk about that and reading about that and innovations in reporting. And I don't want to understate the importance of reporting. But today we're going to deal with the next stages. So the first one, which I like to call the kind of the low-hanging fruit, is data science, and we like to use SQL, but whatever database tool you may like in your organization. So that's level 1. Level 2 is more predictive modeling. What is going to happen using historical data to find patterns and predicting what is going to happen, and then leveraging that in your operations. And then the third is kind of a combination of the above, which is really using data science, predictive elements, but also a certain extent of automation to really improve how people in rev cycle do their job, helping their efficiency and efficacy through workflow automation. So David, let's talk about some of the details in each of these areas and where we focus.
Yeah, thank you, Peter. So to talk about real-life applications in our day-to-day operations and really answer the question of how do we leverage analytics. With denials as an example, we have the ability to calculate and assess every 835 remittance advice daily, as well as historical data going back years to identify trends and denials, which help us in future denial prevention. Big data analytics also allows us to reconcile our entire vendor inventory daily and additionally audit 100% of all transaction-based invoices against contract terms and scope to ensure accurate payment to vendors. And lastly, leveraging data science, we're able to automate daily cash reconciliation of postings to bank deposits. Those are just 3 examples at a high level. As we get into predictive modeling, we can leverage that in a number of ways as well. We can use historical patterns to identify missing charges and validate charge quantities. We can also use predictive modeling against historical medical records and coding to validate accuracy of DRGs. Using a similar approach, we can apply rules to correct accuracy of posted denial reporting from payers to actual root cause. So for example, if Cigna as a payer provides CARC 123, but historical data proves that Cigna CARC 123 is really CARC 456 denial reason at a root cause, we can report 456 instead of 123 to get a true denial reason in our reporting. Similar logic is applied to value accounts by assigning a probability to collect and a sensitivity to effort to value the account and prioritize order of follow-up of AR and denials. The primary sources are both actions taken by humans as well as the data from historical payer behaviors to model and score each account. So next, Peter will provide examples just how analytics and workflow can be leveraged to improve revenue cycle outcomes further.
Thank you, David. We're going to talk today about level 3, which is analytics-driven workflow, and to tell you our story about how we started applying that to collections, and then we used the building blocks that we created to then expand it into payer policy updates to reduce denials, as well as authorization and virtual utilization review. Let's take a detailed look at a quick and dirty way to leverage analytics to find efficiencies in the rev cycle, and this is what I call level 1 or phase 1. I also call it finding money in the seat cushions. In this case, we're using data science and leverage SQL database technology, and our goal here is to detect anomalies specifically in contingency-based vendor invoices, which are typically a significant portion of purchase services within revenue cycle. Typical challenge with contingency-based vendor invoices are that payments and adjustment files are snapshots, and vendors rarely reconcile to provider AR 100%. Transactions post-invoicing are often ignored, and there's an overlap in vendor scope, and it gets pretty complicated to coordinate. So reconciling these invoices is a very manual, labor-intensive, and almost impossible task. So these issues call for an automated solution that's comprehensive and highly accurate. The best case today is that these reconciliations are performed in Excel, which is a tough task, and Excel typically can't handle the logic nor the volume that's required. But worst case is that these reconciliations are handled manually and that they're done on a sampling basis, in which case 100% coverage is usually not attained, and typically 5 to 10% of invoices or of the detail is actually checked and double-checked, and that's a challenge. The solution that we have devised and that we recommend is more of a database-driven approach to invoice reconciliation. All the invoices are loaded into a database. We use SQL database, but you can use whatever you prefer. And then all of the AR transaction data is also loaded into the database. And then an analytics engine actually takes care of the logic and audits 100% of the line items that underlie or drive the invoices. So it compares them to contract terms, it looks for date and payment timing issues, and it compares them to other vendors to ensure that the provider or hospital system is actually only charged once and not twice. Payments are compared to the host system, and examples of discrepancies that we found are that placement dates are actually occurring after the invoice date, believe it or not. Recoupments happen after the collection date, or invoice dates happen before the payment date. All of these items are problematic and should be checked automatically versus manually. Analytics engine can also then compare invoices to contract terms, and these can get pretty complex, as a lot of you may know. Here's some example terms in the contract: patient payment only, bad debt only, dollar ceilings, dollar floors, on and on. There's all kinds of stipulations and complications. And these terms oftentimes change over time, making it even more complex to track them by vendor and to track them over time. And then finally, invoices are compared within and across vendors for duplicate charges. And so our rule is we never pay twice for the same service, and any duplicate payments should be resolved with one of the two vendors. So the key is that this analysis can simply not be performed by a human or only in Excel. It just doesn't have the power that's needed here. It requires database technology. We use SQL. You don't have to use SQL. You can use whichever database tool you want. But we found that you don't need to create an advanced user interface. And that's why I call it level 1 or phase 1, because there's not a lot of fancy programming required. Once you have the database in place, you can be off and running. And here you see some of the SQL code in the background. But it has to be a tool that can accommodate the logic of the contracts, payment review and timing, the duplication, and most importantly, the volume of line item data, which can quickly add into the millions. So this example shows a hospital that we applied this approach to, 22 hospital system, number of vendors approaching 20. We went back 2 years. We audited almost 3 million line items, and the results were really significant. 2.1 million in recoveries, and a monthly recovery rate that's also very significant, above 100 grand. So the average error rate here was 6.7%, but typically, and that's well within our range. So typically, the range that we find is 5 to 7%, very consistently. So again, it's found money. It's level 1. It's data science. We're not really predicting anything, but SQL skills come in handy, and they pay off pretty quickly. Now let's take a look at the potential use of predictive modeling, which is called stage 2. Here are 3 examples of where you can apply. Keep up with my slides. Where you can apply predictive modeling. One is in the area of missing charges and quantities, mostly applicable to outpatient revenue. The second area we're going to discuss is predicting the probability to collect on an account balance. And then thirdly, we're going to talk about expected value of an account to be collected, and also sensitivity to effort. So David, can you take us through an example where we can use analytics to detect missing charges and inaccurate quantities?
Absolutely, Peter. I appreciate that. So as we look at missing charges and opportunity there, identifying missing charges is typically and traditionally resolved by either sampling data or generating exceptions leveraging rule-based systems. Both approaches can be problematic. For example, sampling is limited to bandwidth and scalability. And secondarily, rule-based systems are limited by providing false positives and even false negatives due to requiring both routine and regular updates, maintenance of rules, and complexity of scenarios that can be encountered. As we look at our approach for missing charges through identification of similar patients, so we look at the input of patient data, being visits and visit detail, as well as historical data trending. Similarities across visits are identified to target correlation possibilities. Outlier detection algorithms serve up prioritized and pinpointed recommendations on a daily basis for auditor reviews. And then based on auditor validation and responses, the algorithm itself will adjust to provide continuous improvement in findings. The only instance in which rules are leveraged are really where history does not exist or is insufficient. As an example of some of the impact you can identify from missing charges, you can see some key opportunities identified, such as missing drug administration charges, anything that's really time-based. So as we look at observation hours, we look at surgery time, infusion start and stop times, as well as charge pairings, so such as devices or implants from a surgery or contrast without a radiology procedure or vice versa. Now, beyond missing charges, as we look at predictive modeling, let's take a look at how it applies to accounts receivable and collections. Peter?
Thank you. So in the area of collections, we leverage historical data to determine expected value and propensity to pay of an account. Expected value is simply a micro-segmentation of where we analyze historical collection to identify key attributes of an account. Things like who's the payer, what was the charge balance, how many notes have been taken on the account to date, and what's the account age. So you take, for instance, those 4 attributes, and you look at what historically has been collected in those little micro segments. And so that's one way of going beyond contract value into like payer behavior to identify where the dollars have been collected most readily. The second way, it's a little bit more advanced, is building a propensity model. So we build propensity models that rank accounts by likelihood to pay within a determined time frame, and then you can use those models to re-rank accounts. So that is the second way to rank accounts in a more advanced way to get more accurate. Once you've developed a propensity model, though, it's easy to take the next step, and the next step would be to vary the inputs of the model and determine sensitivity of an account. And what we're trying to do here is to identify those accounts that are sensitive and work those accounts, and accounts that are insensitive to effort, we don't want to work those. We want to stop working those. So I highlighted an example here of what can happen to your productivity when you use this methodology. So you first create the propensity model, then you vary the inputs, you look at the outputs of the model, and then you determine sensitivity. So in this example, we were able to collect the same amount of dollars, but reduce the total work effort by 23%, which is quite significant. So now let's look at behind the scenes to look at some of the variables that drive these predictions. So one of our mantras at Ensemble is that we share the playbook. So I'm sharing the playbook with you somewhat. So these are some of the variables that drive our propensity model: total charges, COB1, who's payer 1, account age, days untouched, etc. These are not all the variables. And when you look at this list, it seems somewhat intuitive, and it should, because it should make some logical sense. But the key, of course, is to figure out what are the weightings for each of these variables, and what are some of the other variables to include. But I just wanted to give you kind of a look behind the scenes, what drives a model, and as you embark on this journey, you might find similar or other variables that would drive your collections. So now let's look at an area where we have really combined all 3 elements together to create productivity improvements, and that's the area of collections workflow. So what we've used to improve collections workflow, and we've really sort of rethought it from the ground up, is number 1, data science, which is level 1 that we talked about, SQL, all that, predictive modeling, and now automation. So the entire UI, how you take notes, how you create templates. We have an entire denials area where we apply automation. So using all 3 combined, this is sort of the 3rd level where you can apply analytics to improve ref cycle productivity. So every day, thousands of collectors are presented with a list of accounts to follow up on through a workflow tool. I'm just sort of explaining how this works for those of you that don't work with these tools every day. Workflow tools then presents the order of the accounts in which the collector is to work them, and it will allow the collector to make judgments and track their progress through their notes. And the workflow tool will then remind collectors to follow up at a certain set interval that is managed through a rules engine. So those are the basics of a workflow tool. So we looked at workflow tools that were in the market, and we started studying data sets to figure out how well do workflow tools work and what is not working in workflow tools. So we came up with this way of looking at it to say, does the effort match the results, and where is there opportunity for improvement? So this slide shows two heat maps. The top of the slide shows notes taken, and the bottom of the slide shows total collections. And the red areas are areas where either the accounts worked heavily, there's a lot of effort, a lot of notes. In the case of collections, there's a lot of cash collected, and blue is less effort or less cash collected. And what you'll notice is that when you apply traditional workflow structure, the effort is a perfect gradient from hot to cold. However, the cash collected is not. In fact, it doesn't track the top picture at all. And so this is what I like to call the workflow challenge. And this is what we set out to solve in our workflow solution. Basically, our goal is to get these pictures to match, not perfectly, but a lot better than what you see here. And that's the opportunity sort of at the highest level. So when we design a workflow system, yes, the opportunity is for automation. That is a good thing to have. But really, what's even more important is prioritization, because we want to make sure we're working on the right accounts that actually are going to make these two pictures look the same or similar. So this shows how we approach that. This slide shows a number of features ranging from the very simplistic, like taking a note, creating an action log, all the way down to next best action. If you were to work on one account today, which account would it be? The top ones are sort of elementary. There's the level of automation that you can apply to each one, building templates, things like that. And then there is a level of prioritization that each feature adds. So the green bar on this slide, to the shorter bar, shows to which extent each feature helps in terms of automation, and that's one area that we discussed previously. But the blue bar, I find a little bit more interesting and important, is how does this feature help us prioritize? And so we try to add as many features as we could that will really help us prioritize better and get those two pictures that we saw on the previous slide to be more in sync. So that's been our overall objective. So let's look at some of the results. On the left side of this slide, you'll see what happens when you re-rank accounts based on more of an analytic approach. This shows, the blue line shows accounts ranked based on account balance, and the red line shows accounts ranked based on expected value. And you can see how the curve moves up, so more cash is collected more quickly. So essentially, we're moving from, in this example, from a 20-65 rule, collecting 65% of the cash with 20% of the accounts, to a 20-80 rule. We're collecting, using expected value, 80% of the accounts, or 80% of the cash, with 20% of the accounts. So that's a nice bump that you can achieve to accelerate your cash collection by using expected value or other analytic methods. On the right, we show you some of the results that we've seen and what we track as far as workflow results. Productivity is one, very important one. Cash collection improvement, and then also, since our workflow contains a denials module, post-denial payments increase. So all these, we see increases. And then lastly, we also track resolution rate, where we like to see a bump. And resolution rate is basically getting the account to zero or to page imbalance. So once we developed our workflow tool, we then said, this is an interesting tool that works very well. It has a certain building blocks like an advanced rules engine. We can embed analytics. We can better rank order accounts. We can track things. Where else can we apply this in rev cycle? So we found a couple of areas. And the first one that we tackled using these exact building blocks is basically payer updates. So today, providers receive hundreds or even thousands of payer policy updates per year. Our internal estimate is that there are about 100,000 of these nationwide. So it's just flooding providers with items that they need to update in order to prevent denials. And so without a workflow or automation solution, this is very hard to track. So we developed a solution using the same building blocks as the collections area and simply applied it to payer updates. And so now that's operational, and it's another area where we've seen the ability to reduce denials, productivity improvement. We're tracking exactly if somebody's overdue with, 10 updates have been assigned to you a month ago, reminders will go out, and we control the process very tightly. So I want to close with some thoughts on how to get started with analytics. Hopefully these ideas were helpful to you, but I think what's more important probably than the specific ideas is sort of the principles behind it, right? And so, and I think with analytics, the main challenge, in my view, is that everybody has these grandiose visions of, oh, we can do this, and wouldn't it be great if, and really the most important thing is, yes, you can have the vision, but you should also get started. And, what have you done for me lately? So in order to get started, I think it's important to look for simple things and quick wins, and don't boil the ocean. Also, many parts of rev cycle have existing solutions in place, and so there's no need to immediately discard existing solutions or rules, but look for ways where we can augment those rules with algorithms or smarter ways of doing things so we can sort of test if they have a lift or not. Obviously, implement in stages, so crawl, walk, run, try something in a very small area of your operation. If it works, okay, now we expand it and we make it a little bit bigger. And then lastly, it really is important to, if you have an analytics team, is to involve the operations experts from the beginning. They need to own the solution. They need to drive the need for it, test it, question things. And so their involvement is really key. So those are some tips as to how you, things to keep in mind as you get started along this journey. I thank you for your time. I hope you found these examples to be useful. We find it a very exciting time to leverage data, and we come up with new ideas every day, and we continuously prioritize them. It's really been a fun journey. And with that, we'll now pause and give you an opportunity to ask questions.
Great. Thank you, Peter Schouten and David Hitzel, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions as we have time for. So there are tons of questions coming in, and one audience member wants to know if Ensemble sells software, or do they offer a web-based subscription or a consulting service?
So thank you for that question. First and foremost, Ensemble is a service-led company. We help our clients with rev cycle issues, and we do rev cycle outsourcing. However, as we served our clients, we have accumulated a number of technology solutions that we've now gone to market with, and our clients can buy them from us separately. And so there are several ways to engage. Our original heritage is to be operators, but we are now also in the business of delivering technology to clients who want just technology.
Great, thank you so much for clarifying that. Another audience member wants to know what percentage of hospitals have actually staffed and or implemented analytical teams and solutions.
That's a great question. I don't have an exact percentage, but I can give you my perception. I think everybody is working on this, and everybody is at a different stage in their journey. Whether they're working on reporting or more advanced analytics, everybody is looking at this, figuring out what to do. I think hospitals are in different stages trying to figure out how fast to move. Everybody sees the opportunity. So I think it's now is the time. People are excited, but I think they're also realistic about what it takes to get results. Some hospitals, I think, are realizing that setting a huge vision without having short-term objectives or low-hanging fruit identified can be an issue because people, management wants to see a return on investment, and so I think you have to do both to be successful.
That is a super great point. Thank you for answering that. The next audience member wants clarification on one point that you guys talked about a lot. She asks, what is your definition of sensitivity?
So that's a great question. So sensitivity, our definition of sensitivity is if you added one more note to this account, will it make a difference or not? I mean, that's a definition that we've used in the model. So you're adding one more note, is it going to make a difference in collection results or not?
Great, thank you for that. Another audience member wants to know if Ensemble software interfaces with multiple EMRs or with third parties, for example.
Yeah, that's a great question. So first off, I have to say that our strategy at Ensemble as an outsourcer is somewhat unique in the sense that we are technology agnostic. That means when we engage with our clients, they don't have to convert to our technology in order to work with us. That's number one. Number two, when we design Ensemble IQ workflow, we really wanted it to work with existing technologies, and so we take feeds from the source systems that our clients have, and we feed information back into those source systems.
We also contain the ability to run the system in parallel. So if you have an existing EMR host system or patient accounting system that you work out of, you could essentially run the analytics engine behind it in parallel.
Great, thank you for clarifying that for that audience member. Another audience member is asking for your guys' expertise. He is asking, what are your thoughts on focusing on the back end of the revenue cycle? Claims that have been denied and or have a higher propensity to be overturned by the health plan.
Yeah, I think so that one absolutely is critical. So we are huge proponents in the value add of pursuing those what would other be considered lost dollars or opportunities to recover. So when we look at back-end focus, I mean, that was really primarily the start and driver of where we began. So the big primary focus being on how do we overturn denials, how do we prioritize accounts receivable follow-up to maximize each effort of an accounts receivable clerk, how do we know going out the door what's going to pay or have a likelihood of pay versus not. That assists us in where do we take human touch and integrate it versus where can we try to automate some follow-up efforts or workflow. Additionally, underpayment recoveries as well as denial recoveries are critical and crucial to not only driving success from a back-end aspect or revenue cycle, but truly getting to a bottom-line impact for our clients and for healthcare systems. So once you have that account at a reserve status, or have taken the contractual expense, any recovery from there obviously is a pickup and an add to the bottom line. So we absolutely 100% focus and believe it's critical that back end is a focus and priority. That should not discount the value that goes into both front and mid-rev cycle, as we also understand and realize that you must work upstream to fix and correct root cause issues of what you're seeing in the back end downstream effects.
Great. Thank you so much for helping us understand the importance of the back end of the revenue cycle as well. The next question that I'm going to throw your way is, do any of your solutions take the analytic solutions all the way to provider calculated payments based on performance metrics for value-based contracts?
We do, and we typically integrate with contract management systems that our clients have, as well as we have our own augmenting calculations.
Great, thank you. The next question is, how do you help coach with data literacy and data storytelling to be the most effective with leadership teams?
Yeah, so this is David. I'll take a shot at that one. So, as a rev cycle operator, I consider myself somewhat data literate, though it's not my expertise. So side by side with Peter, I tip my hat to him on that one. I think for us, it's critical and important to try to translate the analytics or the data, the importance of data, and for lack of a better term, dumb it down to more just kind of day-to-day life or day-to-day living and operations speech. So we try to take, when we talk about big data analytics or artificial intelligence, machine learning, we try to take those terms and kind of say, okay, that sounds great, but what does it mean for me? So that's where, if you go through some of the items we talked about or presented, it's really how do we apply analytics to revenue cycle? And then, so it's translating kind of the data literacy aspect into operations. So we try to approach it that way and coach and explain to finance leaders or rev cycle operations that same approach to kind of translate into where the value lies in data and in analytics, but actually apply it to how does it work in a day-to-day aspect if I'm sitting in my my revenue cycle department or my patient finance services departments.
Great. Thank you for clarifying and taking a stab at that answer. The next question that I'm going to throw your way is, what is a realistic timeline for getting a solution like this implemented?
That's a great question. So we talked about the 3 stages, right? So the first stage is very quick, a couple of weeks. And when you talk about predictive models, I mean, you're talking about months, right? 3 to 6 months, 3 months to develop the model, and then, running some tests and then doing the implementation. Now, workflow is interesting. I mean, to build a workflow system will take years. So, but I think there's other approaches. You can rent the workflow system or buy it from somebody. In our case, we can load the data into the workflow system. From the point we have data, it's really only a three-week implementation period. Now, if you have a workflow system yourself, you like it, and you want to add analytics, I think you can also do you can make a lot of improvements within a matter of 4 to 8 weeks. David's worked a lot with different workflow systems, some of which are not our own, where we add prioritization or we do automation. And so those implementations they're kind of project-based, but they can be, a matter of weeks.
Yeah, you can find quick wins in 2 to 3 weeks. Some of the larger projects, will scale 6 or 12 months. But
Great. Thank you so much for answering that. The next question, is based on The fact that payers make a lot of changes. The audience member wants to know if you guys at Ensemble update the edits each time payer bulletins are published.
Yeah, so using the workflow solution that we shared around payer updates, we actually utilize that basically as a platform to track the updates that are coming in. We use algorithms to assign those to individuals, as well as have a quality check behind it to make sure it goes to the right group. And then, so it's basically our workflow tool to make sure that the edits actually do get applied or updated as needed. So each incoming alert is reviewed, it's prioritized, it's defined as either actionable or not. And if it is actionable, will get assigned to the appropriate party. So whether that be billing or denials, or even back to the facility, your pharmacy leadership or clinical departments, that way they can take the appropriate actions and steps, and then they actually resolve that when market is completed within the workflow tool. So it's basically the quality check and the monitor to make sure that actions are occurring, because the payer updates just tend to be such a high volume task and administrative burden. It allows us to monitor that and essentially automate a good portion of that workflow to ensure that we're making the necessary updates and changes.
Great, thank you so much. We have another audience member asking about best practices, and they're asking if you find it better to have an in-house analytics team reside in the business units, or if they're better off being consolidated under IT.
So that's a great question. I mean, I personally, RefCycle is so domain specific. We think it's better to have analytics folks reside within RefCycle and live as close as possible to the operations folks. The further away they are from the process, from the domain expert, I think the more challenging it can get. Having said that, if you have a very small system and you have to kind of pick your battles, and you might have a centralized group, I think it can be done. You just have to keep the same principles in mind. So make an effort to, if you're working on a RefCycle issue, to be close to operations. What would you add to that?
Yeah, no, I agree, Peter. I think it's absolutely critical to keep analytics, keep workflow improvement, your technical teams as closely tied to revenue cycle, preferably directly within, that you can. Again, to your point, if there's limitations to the structure and you cannot, make sure you get that. You stress the importance of the value add of an effective revenue cycle or improvement efforts to try to get that resource at least dedicated to projects and optimization work as it's needed.
Great, thank you. The next question is, when you engage with a client, who owns that data?
The client owns the data, bar none.
Perfect. Thanks for that short answer. The next question is, once you have the invoice reconciliation report, what is the suggested next step with the vendor?
Yeah, so once you have the report, it really becomes a collaborative process. The vendor becomes part of the discussion. We sit down with the vendor and the client and show the results. Most of the time, these vendors may have some process issues. Very seldom is something nefarious going on. And so a collaborative approach really allows vendors to learn from the process as well, provide feedback to where we might need some tweaks, and come to a final resolution on whatever the findings are. So it really is, showing them the detail, showing them this is what we found, and it becomes an educational process for them as well.
Yeah, because the details provided at the account level basis and the reason for it flagging as an outlier, you can literally walk account by account through with your vendor partner to root cause and troubleshoot if it was an issue, what caused it, and then if it's about overpayment or not.
And oftentimes it results, the process also results, one side effect that I like is it results in contract improvements, where both parties recognize, hey, this is something that we need to cover in the contract that previously was unclear, might have been a gray area, or omitted.
Great, thank you so much. The next question is, besides SQL, what technology investment is required to execute the analytics covered?
So that's a great question. So SQL is something we use heavily. For modeling, we use R, and R is free. Also with SQL, there's SQL reporting that comes with it. That's also free with your SQL license. And then workflow, of course, is a little bit more of an investment, but typically we provide it on a subscription basis, and so it's not an upfront type investment. At least our model is subscription based. So SQL, R, and workflow. I think that covers. Did I forget anything? That covers it.
Great. And that same person wanted to know if that is used for predictive analytics.
Yeah, it's R and Python. I should mention Python. Yeah.
Great. Awesome. The next audience member would like some clarification on a topic brought up earlier. He asks, when you said earlier that you do not recommend a black box approach, does that mean that your tool would be able to provide us with the insight we need in order to understand why our particular claim has been prioritized over others?
Yeah, that's a great question. That's exactly what our task is, and that's exactly what we deliver. So in order for collectors and directors to trust the system, work with the system, and rely on the system, we will provide why we prioritize something. And we have a system of flagging, which basically will highlight the reasons. It allows you to sort accounts and will highlight the reasons behind why we identify a certain account as either a high priority or something that we need to address within part of the workflow.
Thank you so much. The next question is, do you use an agile approach to developing analytical reports, dashboards, and tools?
Yeah, that's a good question. So yeah, we use agile, and for those on the phone who are new to software development, it simply means that we collect some requirements, we design an initial version 1, which we then quickly put back in front of our users and stakeholders for further feedback, and then we iterate. So it's an iterative approach that moves very quickly to what's called an MVP, or a minimal viable product. So it's a fast way to go to market that basically limits or prevents this whole dilemma of going through a 6-month requirement phase, and by the time you get through the requirements phase, the requirements are already out of date. So yes, we use agile approach, and we like it.
Great, thank you so much. The next question that I have for you, and we'll try to sneak in a few more before the end of the hour, but this question, an audience member wants to know how this solution and how all of this is different from the high to dollar follow-up.
Yeah, so I know Peter will probably add in, but it's different in the sense that your traditional high dollar value or high dollar follow-up may or may not actually take into account the value of the AR. So if you are doing a net down, then there's a high probability that you'll have a good value grasp from a contract expected reimbursement there. But what the value out of the model and the prediction is really around adding in other factors like age, past payer behavior, the type of service or type of account when it looks at similar or like accounts over the entire historical sample, to start identifying even though it is simply a high dollar account, does it really mean it's high value, or is there a high sensitivity that if I work the account, it's actually going to result in dollars? So it takes kind of the traditional high dollar approach and just kind of multiplies or adds in multiple different fields and inputs to actually value the account further to say, of all of my high dollar accounts, which ones should I work first because my next action could result in a payment, versus which ones may take 3, 4, 5 actions, or which ones may not pay at all based off of the type of account and the history that's associated with it and other like accounts.
Awesome. So it looks like we have time to sneak in one more, and that is, what is your experience in Millennium, which is the Cerner system?
Yeah, so we have a few clients that we've engaged with and work with that are on Cerner Millennium. So experience there either way is we can work within Cerner itself and work to get feeds to optimize the flow of accounts and work within the system itself. Or we've even have the ability, if desired, that we could overlay a workflow tool on top of to power the analytics through a bolt-on. So either way can be worked with. So it's basically taking the same set of data feeds that we would want. So basic account demographics, 835, 837, some other file inputs, and then we leverage it the same way as we would any other patient accounting system or host system. So again, we remain pretty system agnostic. As long as we can get an extract of the necessary data fields, we pretty much have free reign to work within any patient accounting system.
Great. Thank you so much for answering that. Before we close out, Peter and David, do you have any final thoughts that you'd like to share with our audience?
Yeah, I just want to thank everybody for dialing in. We're just overwhelmed by the amount of interest, and really, this is the time, I think, where everybody's looking to big data and analytics and artificial intelligence to really boost their results. So we look forward to any feedback that you may have for us after the presentation, so we can do these again and make them more useful for everybody. But I'm just really grateful that so many people dialed in, and I think we were approaching like almost 1,000 registrants. So it's a very exciting time for us, and we want to thank everyone.
Yeah, likewise, I echo the thank you and the gratitude for your time this afternoon and attention. Hopefully there's value there for you. I kind of tail off of what Peter said is I think the real, the exciting part is taking the analytics and what we have accessible to us from all the data inputs in healthcare and within our revenue cycle and really turning it into action. So that's the great part of taking analytics and be able to turn into something meaningful that gets us an output. So hopefully this started to generate some ideas and concepts of how you can apply that within your own organization.
Great. Thank you, Peter and David. That is all we have time for today. I want to thank Peter Schouten, Chief Analytics Officer, and David Hitzel, Vice President of Revenue Cycle, for their excellent presentation, and Ensemble Health Partners for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.